Breast augmentation is a plastic surgery procedure where silicone implants are used to enhance not only the volume of the breast but also the shape of the breast. Breast augmentation with silicone implants is usually done for those women who have underdeveloped breasts and who want to increase the size of the breast. The second subset of patients who benefit from a breast augmentation would be those ladies, women who've delivered children and in the post delivery period, much later after maybe 6 to 9 months, feel that their breasts are sagging and there is a loss of volume in their breast size. So these are other patients who can benefit from a breast augmentation. The third subset of patients are those patients who have gross asymmetries in the breast when there is a variation in the size of both the breasts. So you might have to reduce one breast, you might have to increase the size of the other breast. So this is another patient. And there are also congenital disorders, birth disorders, where the size, the shape of the breast and the size is lacking on one breast completely. So this can be actually unilateral or even bilateral on both the sides, and breast augmentations can come handy for such patients also. The first step in a breast augmentation is the consultation itself. Now, the patient comes to us and she is actually telling her desires, what she wants to be like, what is the size she wishes, and if there is any thing about the shape which she feels. She discusses how much of volume she needs to increase. So we take the patient's expectations, we listen to the medical issues within the patient, and then the examination starts. Now in the examination, there are a lot of measurements which we as plastic surgeons take. The most important measurement is the base diameter of the breast, and we mark these measurements, and depending on this we order the implants, and then we tell the patient that this is what is a suitable implant which can get into her after a detailed consultation. Now usually what happens is, when we explain the patients the limitations of doing an augmentation and when she is actually in sync with what we say, then we get into a desirable contract and we do the breast augmentation surgery. But sometimes there can be patients who have unrealistic expectations, where they want to go way beyond their measurements and their parameters, and this is where the plastic surgeon's counseling starts, and we'll have to tell the patients that it may not be desirable, and we'll have to tell them the risks and complications which may happen after a very unnaturally big breast augmentation. Breast augmentation typically is carried out with 3 incisions. One is the submammary incision, which is given in the fold just below the breast in the crease, and which is hardly around 5 to 6 centimeters in size. And the other implant, the other approach for putting a breast implant is through the axilla. Hidden incision is made in the axillary crease, and implants are pushed in even through the axillary approach. The third approach to putting breast implants is the periareolar technique, where the lower part of the areola is cut and the implants are pushed through the areola. This may not work out in all patients. Some patients may have a very small areola, and obviously this may not be the right approach. But in those patients who have a bigger areola, this is one of the possible options, because this scarring is very nice, and it's not much, and it's very inconspicuous, and thereby making this approach also another suitable option. A lot of our patients ask us what is the cup size I can normally increase. So this is a very good question, and how we tell our patients is based on the diameter of the breast. So once we choose an implant, based on the diameter, we go back to the company manuals and we select the right implant suitable based on the breast dimensions. Now, let's say we choose an implant which is around 300 grams of implant, and usually 300 grams of implant would mean that the patients increase the cup size by around 1 to 1.5 times. So every 200 grams of implant which is put in, the cup size increases by 1. So if you have an implant which is around 400 grams or 400 cc, the cup size would be almost by 2. If you have a 600 cc implant, which is a very big implant, the size goes up to almost 3 times. So every 200 cc's of implant, it actually increases the breast size by a cup. The post-operative care after a breast augmentation is wearing a surgical bra for a period of 3 to 4 weeks, and this usually helps in controlling the swelling. It helps in maintaining the shape which we have given you, and also the pain component is much less when you wear a surgical bracery. So we would advocate that everybody wears a surgical bra for a period of 3 to 4 weeks. Now, usually the sutures are removed after a period of 7 to 10 days, and the massaging starts after a period of 7 to 10 days, and this usually continues for up to 3 to 4 weeks. The massaging helps in relieving getting rid of the swelling in the breast by milking out all the fluid which is actually forming on the chest wall, and thereby getting a natural result at the earliest possible period. Following a breast augmentation, after the swelling subsides, you can usually see a result after a period of 3 months, when everything is subsided, the scars are actually settled down, and that's when you'll be seeing a very natural result after the breast augmentation surgery. So to conclude, breast augmentation surgery with silicones is a very, very rewarding surgery. You can go through it very, very safely, and once your expectations match the surgeon's deliverables, you can actually get the surgery done, and it's very, very rewarding.